Today I will be presenting you with depression and medication. Have you ever been prescribed a medication that has caused you to notice any physical or mental changes? Or possibly a medication that has caused you to act out abnormally? There are many different side effects while taking medication for depression, also known as antidepressants. So some of the few symptoms that or side effects that you can notice while taking antidepressants would be along the lines of suicidal thoughts, agitation, restlessness, um, displaying different emotions of anxiety, and it oftentimes can make you feel worse than how you felt before. There are different ways that these medications can make you feel. There's different factors that go along with it. One being that all antidepressants affect your brain's two neurotransmitters, which would be your serotonin and your norepinephrine. So oftentimes when a doctor's prescribing medication for somebody who has depression and they need to get on antidepressants would be in a difference of SSRIs and SNRIs. So SSRIs are serotonin reuptake inhibitors, while SNRIs are serotonin norepinephrine reuptake inhibitors. The only difference is that the SSRIs are taking care of only your serotonin levels, while SNRIs are taking care of your serotonin as well as your norepinephrine. 11% of the population does take antidepressants, while 40% of that has stated that they have experienced some sort of adverse effect when it comes to taking these medications. These antidepressants can make you feel more tired. It can kind of mirror or heighten effects of your depression, but it can't make your depression any worse. So it can cause you to have lack of sleep, too much sleep, changes in your appetite, not able to concentrate. There's a lot of different factors in what causes your side effects, but there are different ways that those can be managed to kind of lessen those effects. One being, never mix your antidepressants with any sort of alcohol, as well as not taking any more medications unless your doctor has prescribed it. If you're not sure of what you can and can't take, always contact your care provider or your doctor just to make sure that you're not potentially putting yourself in danger. Another way that you can kind of lessen these effects would be not to cut your medication off by yourself. So not cutting them off cold turkey, in other words, just completely stopping them, because your brain is already dependent on that medication, that if you just randomly go off of it, it's going to get confused. You're going to start feeling these effects and it can get heightened. So that's one way that you would want to lessen these effects, by not cutting that medication off cold turkey. In conclusion, always contact your care provider or your doctor should you experience these types of symptoms. And like said previously, not cutting off your medication on your own. Always talking to your doctor about a plan should you want to get off of those medications, and tampering the dosage off of that instead of just doing it yourself, because this will cause you to feel some sort of withdrawal and can make you experience these adverse effects to a way bigger extent than what that you might have felt before. Taking those medications as prescribed, not lowering or making them go any higher as far as your dosage, and always making sure that whatever it says on the bottle or whatever your doctor told you to take is what you're taking. And last but most importantly, listen to your body. You are the only one that knows your body, more than anybody else, and that's ultimately is what's going to cause you to kind of notice these effects should you have them. And just making sure that you're being aware and in the know of what's going on if you experience physical, mental, or any sort of abnormal side effects while taking antidepressants.